about back here? Nothing?
Injury assessment helps you identify injuries that affect the patient. You can attend to some of the injuries and you will report them to emergency medical personnel once they arrive. Remember that you always begin with primary care using ABCABS and the cycle of care to guide you. Assess the scene. Stop, think, and then act. Apply your barriers if readily available. Give your responder statement while checking to see if their airway is open and noting if she's breathing normally. Contact the local emergency medical service if at any time you begin providing primary care or you feel that you will need assistance.
Let's call for some help.
Be sure that you attend to any primary care issues before beginning a secondary injury assessment. Start by telling the patient that you're going to check for injuries. Hold the patient's head and ask the patient to keep her head still and answer questions verbally rather than nodding or shaking her head. It helps to ask questions that she can't answer with a yes or no. You start your assessment at the head and work to the patient's toes. If the patient complains of head, neck, or back pain, stop the assessment immediately and keep the patient immobile until help arrives. Feel for deformities on the patient's face with a gentle touch. Check the ears and nose for blood or fluid. See if the patient's pupils are the same size and have her follow your finger with her eyes without moving her head or neck. Check the eyes for smooth tracking. The eyes should track together. Also, check pupil size. Feel the skull and neck for abnormalities. If the patient complains or you find something, stop the assessment. Slide your hands over the shoulder blades and gently push against the back. Press inward on the shoulders and run your fingers over the collarbones to the center. As you perform these steps, you're looking for irregularities or blood, or for the patient to mention pain or other unusual sensations caused by your touch. Stabilize the patient's arm with a hand on the shoulder and slide your hand gently down the upper arm, elbow, and wrist. Repeat on the other arm. Ask the patient to wiggle her fingers on both hands and squeeze yours to check for paralysis or weakness. Inspect the chest for deformity. Place a hand, palm in, on each side of the patient's rib cage and gently push inwards. Gently put your hands under the patient to check the spinal column. Cover as much area as possible without moving her. If you find any irregularities, stop the assessment. Ask the patient to tell you if she feels pain. Gently push on the patient's abdomen on the right, left, and above and below the navel. Move hands gently over the hip bones to check for swelling or hardness, tissue softness, unusual masses, joint tenderness, and deformities. Avoid pushing inward on hips. Ask the patient to wiggle her toes and press her foot against your hand. Repeat this with the other leg. After your assessment, you will attend to the injuries you can. Otherwise, continue to monitor the patient using the cycle of care to guide you and report what you found during the assessment to emergency medical services personnel.